Hi, my name's Dean. I thought I'd do a video rather than try and do lines of text. Plus, I've had loads of people, three, ask me basically the same question as you have. So, why am I involved in this? Well, my wife was suffering from painful HBM and she went to the doctor just thinking she could go back on the pill, and she went, nope, need to send you for a scan. Scan was clear, however, the doctor didn't fully understand the NICE guidelines and said, I need to send you for a biopsy. She didn't need to, however, to be fair, when someone's suffering from a VAS score of 9 every month, you do kind of need to have a look around. We received no literature, no pamphlets, anything. I googled a bit. When I went with the wife for her smears and swabs, I do have the wife's permission to talk about this, by the way. She said, I got to send you for a biopsy in camera. And said, do you mean hysteroscopy? And when I said that, she visibly squirmed in her seat like I had tasered her. She was really made uncomfortable by me saying hysteroscopy. So I was like, that's not what you want to see when my wife's been sent for this kind of test. So I looked into it a little bit more when I went with the wife to see the consultant. Talked about several treatment options. I did ask, oddly enough, I said, could you have a subtotal hysterectomy? And she laughed and said, they don't do those anymore. You haven't read the leaflet. To which we both said, what leaflet? So the lack of information around this was quite high. Now I said I wanted GA, was offered a GA, however there was no mention of word pain or any reason why, other than you wouldn't want to be awake or why you would want this procedure under a GA. She had a GA, she said I wanted GA, and if anything the consultant was actually quite relieved to be doing it under GA. The pre-amps nurse was fantastic. She actually said, yeah, I don't blame it, it's your treatment, it's your decision. I'm not having any more in outpatient, as she said, rubbing her belly. So, however, on the day of the procedure, the consultant said, why are you here? This is normally done in outpatient, because she would know, because she did the outpatient ones, about if it was done because of the failure rate. And the wife gave her reasons, which included pain, because I had seen the pain scores through the Freedom of Information Act for that particular hospital, and that is severe pain, a VAS score over 7, of 1 in 4, and a failure rate of about 1 in 10. Now, that's quite high. I think that is something that should be told patients, that there's a 1 in 10 chance that you're going to have this done under GA. That's very high. That's a common occurrence, not being able to do it. It's about 5 or 7% with pain and about 5% technical reasons. So, well, I've had a very positive experience, but several forums and several discussion groups where women have not had such a positive experience, and sometimes it's because they're not told the truth that this is potentially painful. They're not told the risks. Sometimes perforation, or that's rare, they tend to quickly glance over that, or the risks are exaggerated for theatre, because I did ask the consultant as the highest slight risk of when this is done in theatre, and she went, statistically, to quote her exactly. So that's why I'm involved in that, because I keep seeing repeated testimonies of particularly on care opinion, of not being told informed consent, the risk of the procedure, not being offered anaesthesia of any sort, because it has to be said, it would have been nice for the wife not to have been offered a GA or paracetamol. There is anaesthetics in between, and hopefully there's going to be stuff developed, but you can't develop stuff if people aren't putting their hands up and saying there's an issue, let's try and find an anaesthetic analgesia solution, rather than saying no, women tolerate this well, finding that most people voted for Brexit, it's semantic sometimes just to say, but I am seeing quite often, and I've talked to quite a few women personally as well, that have said, as you say, pain was simply ignored. They've asked to stop, they said they were screaming, fainting. Sometimes, quite often, particularly with postmenopausal women, they're getting where they can't say anything. There's like a lock with the pain, and I'm finding that women aren't being properly monitored during this procedure. Why am I so passionate? Well, I think I don't really know. I would guess that I'm just angry that my wife wasn't given a real, I wouldn't say choice. I'm angry that other women aren't being given a real choice. I hear one particularly women being denied cervical blocks when they've even asked for them. I think I'm angry because my wife wasn't given a genuine information, and that the doctors I grew up with would have said, been more honest about the advantages and disadvantages to this. Living in a bit of a fantasy world, but I would like more of a conversation, like because it was told to the wife, hysteroscopy, this is done in outpatient. I'm going to stop you there and actually had a conversation about this. I actually like women to be told this can be done, there's several options this can be done. There's risks and benefits, advantages and disadvantages to both. It's usually quicker, more convenient in outpatient. However, that's not always the case. There's always the risk of severe pain and the procedure being abandoned. If it is abandoned in theatre, you won't either be awake or you won't feel any pain. And for women to be offered this properly and training as well, we're finding the skill level is pretty poor. How do I? Yes, I am reasonably knowledgeable on this. Obviously, I'm not medical, not a gynecologist by any means. But the wife said, will you look into this, please? It's making me feel anxious. Obviously, she didn't intend for me to read peer-reviewed papers, and these other women that have done a lot of research on this, and I stand on the shoulders of giants when it comes to information, getting genuine information and challenging told, i.e. you keep reading, most women tolerate this well, most women find it high patient satisfaction, until you read the actual papers and you go, that isn't what I get out of that. I'll give you an example. In Wimp's Hospital, there was a virtual reality trial where they gave goggles and a picture of Serene, and David Attenborough's voice was on these pictures of tranquil scenery as a distraction technique, and it did work, but there's a couple of caveats. One, you got severe pain from 75% to 40%, so 40% still extremely high. Secondly, they found that the pain reported by the clinician or nurse had often no reality to what was reported by the patient, both ways. Those in quite severe pain, nurses or clinicians reported low pain, and when the patients reported low pain, they were often finding the nurses report or clinicians report perceived that they were in quite a bit of pain. So no matter how caring and considerate and wanting to actually be the patient's advocate you are, you actually do need to ask the patient. Actually comes down to communication, because Humans are not very good at perceiving another person's pain. Actually, it has to be asked. That is not happening in outpatient hysteroscopy, and that's just diagnostic. When it comes to operative and ablations, 90% of women find it very painful. Only a few percent report of little or no pain, and some hospitals do not offer this with any sort of pain relief. It has to be done on outpatients. It's not particularly legal, but look at the Montgomery case. Court cases need to happen before stuff actually changes. So, ending remarks. Why would you listen to me? Well, I talked to a lot of women about this and ask. I'm not locked into one experience or perspective. And secondly, I can put you in contact with these women. The reason I don't want to tag you in stuff, and then you go, "What's this?" Or particularly because there's a Facebook group, and if they find out who you are and what you do, you will be jumped on and attacked basically. And no matter how much they look, this isn't my experience. My clinic's good. You will still be quite upset, reasonably, understandably so, quite upset women will be going, well, that's not my experience. Also, I have to say that the Campaign Against Painful Hysteroscopy did a survey with a few Facebook ads and got 1,500 stories back of horrific or bad experiences in outpatient hysteroscopy, and your hospital wasn't in them as far as I know. So, although Birmingham's Women's Hospital was, so that's something to think about, is that perhaps this is why you're having a disconnect between what you read. But at the end of the day, if this procedure is painful and it's stopped, there's no harm done. Pain, stop, reschedule. But that isn't what's happening, and I can back that up with a lot of testimonies. So I'm a little concerned about scaring you off, but a little bit concerned about how to have a genuine conversation, because I have actually helped one hospital review their patient information leaflet. As I say, I have spoken to quite a few gynecologists and nurse hysteroscopists and so on. So there you are. Please let me know your thoughts. Respond to me however you want. Thank you. Bye.